The Matter of Gender by Nikki Sullivan. The social history of our era cannot be written without naming gender, gender role, and gender identity as organizing principles. John Money, The Concept of Gender Identity Disorder in Childhood and Adolescence After 39 Years. In the popular imaginary of the present, John Money is most often cast as the quintessential social constructionist, as someone who claimed that gender is solely an effect of enculturation and, as such, is radically mutable and alterable. For some, Money's purported theory of gender as an effect of nurture, as opposed to nature, made him one of the gurus of the second-wave feminist movement, a characterization that seems to sit uncomfortably with Money's criticism of what he saw as feminism's conceptual neutering of gender. For others, Money's clinical attempts to prove his theory have, particularly in light of the David Reimer case, shown his ideas to be both flawed and dangerous, and his practice to be unethical. Interestingly, in one of the most influential popular cultural texts on Money, As Nature Made Him, The Boy Who Was Raised as a Girl, John Colapinto's characterization of Money as a constructionist is an inferential effect of the author's narrativization of a world of goodies and baddies, truth and lies, fact and fiction, males and females, rather than something that is convincingly argued through a close engagement with Money's writings. But despite this, Colapinto's text, and in particular his view of Money as a constructionist, seems largely to be taken as gospel. Money himself would dispute this view of his work, arguing instead that his account of gender identity role, GIR, a concept I will discuss in detail in due course, is interactionist, that is, it acknowledges the generative effects of both biology and culture. Indeed, it is on this basis that Jennifer German has recently argued that Money's gender offers a third wave of productive potential, one that differs from the second, as in second-wave feminism, precisely because his theories presuppose an interactive relation of cells to environment and to experience. German's optimism is challenged, however, by Leslie Rogers and Joan Walsh's much earlier claim that it is not an interactionist approach to swing towards biological determinism most of the time, and then occasionally, when it suits, to swing towards the environmental side. As they see it, insofar as the model of gender attribution that Money and his co-authors articulate is underpinned by extremely conventional assumptions about and attitudes towards sexual difference, any attempt to articulate thoroughly the role of the social in the attribution of gender is wholly undermined. They write, while Money, Earnhardt, and co-workers consider the social aspects of gender, they take for granted that there are two genders, that there are differences between them, and that fundamentally gender is a consequence of a biological blueprint for behavior as well as physique. Similarly, Ruth Dowell and Helen Longino have argued that Money's model of gender is more accurately additive than interactionist, since it does not explain how biological and social variables work in tandem, but rather posits the biological as foundational. There is little doubt that Money's work, in particular his elaboration of gender, has been hugely influential, and that rather than being confined to the worlds of scientific research and/or clinical practice, its influence has shaped us all. Consider, for a moment, the extent to which gender, however one might conceive it, has become central to everyday life, so much so that it is difficult to imagine how we might function without such a concept. This alone, it seems to me, is reason enough to engage with Money's vast oeuvre. But further incentive comes from the fact that while competing interpretations of Money's work are readily available to those who choose to seek them out, the popular image of Money as a constructionist abounds. This characterization is an oversimplification of Money's work, and one which can only be maintained through a lack of engagement with his writing. If, as feminists have long argued, ongoing analyses of identity and difference, and in particular, so-called sexual difference, are politically imperative, then a close engagement with Money's highly influential texts, the assumptions that informed his claims, and the ongoing and multifarious effects such claims produce, likewise seems called for. In critically interrogating Money's account of GIR, my aim in this chapter is not so much to definitively classify his work as either constructionist or determinist, but rather to trouble the very tendency to see in dimorphic terms, since, as Helen Longino has noted, As long as dimorphism remains at the center of discourse, other patterns of difference remain hidden both as possibility and as reality. Money's gender. In popular parlance, gender tends either to be used as interchangeable with sex or, alternatively, to refer to the social, as opposed to the so-called biological or sexed, aspects of femaleness and maleness. In both cases, gender is a term that is commonly used to classify others and to refer to our own sense of ourselves as male or female, men or woman, neither or both. Despite the fact that such conceptions of gender feel self-evident, they are, in fact, relatively recent. It has been claimed by Money and others that the first use of the term gender to refer to something other than feminine and masculine forms within language occurred in Money's 1955 publications, Hermaphrodism, Gender and Precocity in Hyperadrenocortism, Psychologic Findings, and, co-authored with Joan and John Hampson, Hermaphrodism, Recommendations Concerning Assignment of Sex, Change of Sex, and Psychologic Management. Indeed, it was through his early work with intersex patients that Money came to consider the term sex inadequate to describe the lived embodiment of those whose anatomies are either discordant or do not appear to match the sex roles associated with masculinity or femininity and or the sense of self a particular individual has. For Money, intersexuality challenges the common sense idea that sex, as naturally dichotomous, is a biological characteristic that at once determines genital morphology and can be determined with reference to that morphology, and that sex roles naturally follow from genital morphology and are concordant with it. It is possible, writes Money, to have the genetical sex of a male, the gonadal sex of a male, the internal morphologic sex of a male, the internal genital morphologic sex of a female, the hormonal pubertal sex of a female, the assigned sex of a female, and the gender role and identity of a female. Hence, Money's coining of the term gender, or more precisely, gender identity role, GIR, to refer to the multivariate character of the totality of masculinity, femininity, genital sex included, that each person attains even when the multiple aspects of the self, as a man or a woman, are seemingly discordant. What we see here, then, is that for Money, gender is not synonymous with sex, as a set of biological variables, but nor are the 5 aspects of sex that he identifies in the above quote entirely separable from GIR. Money conceives gender identity and gender role as obverse sides of the same coin. They constitute a unity. Without this unity, he argues, gender role becomes a socially transmitted acquisition, divorced from the biology of sex and the brain. It becomes desexualized, cleaned up. As Money understood it, gender identity is the experience one has of oneself as a man or a woman, the kingpin of your identity, as he and Patricia Tucker describe it, and gender role is the manifestation of the sense of self in one's daily performance of self. In sum, one's performance of gender reaffirms one's gender identity, in particular because it is through gender role, as everything that one says or does to indicate to others the degree that one is either male or female or ambivalent, that others perceive and position one as gendered in a specific way. There are, of course, situations in which others' perception of the gender of an individual may not fit with that individual's self-perception, but this is the exception rather than the rule. As Money explains it, gender role is performative in 2 senses. It is an action or set of actions one articulates corporeally in a world of and with others, and, at the same time, it is constitutive of the self. In other words, gender role makes one become male, female, neither or both, in and through what we might call, although Money himself does not use this term, sedimentation. The more we repeat certain actions, the more naturalized or habituated such actions become, and the more they come to appear, both to others and to ourselves, as external expressions of who we really are. Clearly then, while GIR may be affected by, for example, gonadal morphology or hormonal activity, it is never wholly determined by what we commonly think of as biology. But nor, if GIR is intercorporeally reproduced, can it be radically open and or free, or at least, that is what one might suppose. For Money, however, the story is a little more confused and confusing, as we shall see. For Money, the ability to acquire a GIR is phylogenetically given, whereas the actuality is ontologically given. In other words, while all humans share the ability to acquire a GIR, the GIRs we each develop will differ according to context, pre- and postnatal history, morphology, and so on. For money, then, the ability to acquire a GIR, which he refers to as a philism, is, like the ability to acquire language, to breathe, to laugh, or to pair bond, sex-shared. He writes, "You were wired but not programmed for gender in the same sense that you were wired but not programmed for language." There are, however, philisms which, according to money's conceptual schema, are exclusive to either men or women. These are lactation, menstruation, ovulation, and gestation, which are allegedly exclusive to women, and impregnation, which is allegedly exclusive to men. Money refers to these as sex-irreducible dimensions of GIR and differentiates them in kind from what he classifies as the sex-derivative, sex-adjunctive, and sex-arbitrary or sex-adventitious dimensions of GIR. What begins to emerge here, then, is a categorical distinction between aspects of GIR that are universal and somehow determined by sex, as a set of biological variables, and aspects that are context-specific and an effect of a particular society's customary way of doing things. So, for example, while one can acquire the ability to operate a heavy goods vehicle in and through particular cultural processes, e.g., driving lessons, one cannot acquire the ability to ovulate ontogenetically. A similar ontological move is apparent in money's claim that philisms that are sex-shared are sometimes threshold dimorphic, such that, for example, adolescent boys are more readily aroused by sexy pinup pictures than are adolescent girls. It is possible, writes Money, that divergent threshold levels are preset as early as in prenatal life when steroidal sex hormones organize by potential brain regions and pathways to differentiate as predominantly either male or female. From animal experiments, there is abundant evidence that such organization does indeed take place. Throughout Money's work, the lowering of thresholds is vaguely associated with, although never convincingly connected, at least not in a straightforward causal sense, to prenatal exposure to hormones, most particularly androgen. I want to suggest that in both the examples discussed, we see that for Money, GIR is never a purely social phenomenon and, while the acquisition of GIR necessarily involves what we might ordinarily think of as biological processes, these processes are never wholly determinative. For example, even though the ability to menstruate is associated with women, it does not guarantee a female GIR, as the existence of trans men or female-to-male transsexual shows. Conversely, an inability to menstruate does not mean that a person raised as female will not continue to identify and live as a woman once amenorrhea becomes apparent. Consequently, Money describes his model of GIR acquisition as biosocial and interactionist, and as developmental and sequential as opposed to causal. As I said earlier, Money's proposition that identity does not strictly follow from anatomy, or, even when it appears to, that anatomy is not the cause of GIR, is an outcome of his early work with intersexuals, and later, with individuals desiring to undergo sex reassignment procedures. The clinical challenge Money faced in both cases was the question of whether or not surgery should be performed, and if so, on what basis its practice might be justified. Central to Money's theory of GIR, and to his recommendation that both infants with atypically sexed bodies and adults whose gender identity is, according to normative logic, at odds with their genital morphology should undergo surgical transformation, is his concept of the critical period of development. Critical periods occur, according to Money, both anatomically and in the development of GIR more broadly, and each is marked, metaphorically speaking, by a gate that, once closed, is at best unlikely and at worst impossible to reopen. This closing of gates along a developmental pathway locks in GIR such that one's sense of self and one's gendered performance becomes increasingly sedimented as one's subjectivity develops. You acquire, developmentally, a native gender, or, to put it somewhat differently, biopotentiality becomes monopotentiality. Money writes, as you approached each gate's sex differentiation point, you could have gone in either direction, but as you passed through, the gate locked, fixing the prior period of development as male or female. Your gonads, for example, could have become either testicles or ovaries, but once they became testicles, they lose the option of becoming ovaries. In behavior, at first you drove all over the highway, but as you proceeded, you tended to stick more and more to the lanes marked out and socially prescribed for your sex. Gender identity differentiation and/or gender maps. Sexology, writes Money, is the science of the differentiation and dimorphism of sex, of the biosocial processes that shape us as women, men, and, very occasionally, androgynous. Sexology's advantage in the mapping of these processes lies in its multi- or transdisciplinary approach, an approach that, as Money tells it, allows him to avoid the all-too-common tendency to divorce the biological from the social, nature from nurture, sex from gender, body from mind. Indeed, from Money's perspective, the splitting of sex and gender and the establishment and maintenance of disciplinary boundaries and discipline-specific knowledges and practices have, historically, been mutually constitutive and have resulted in what he describes as enormous doctrinal damage. Money asserts that his work bridges the chasm between social and biological definitions of gender, as well as that between the hard sciences and the social sciences in and through the conception of GIR as the effect of multivariate and sequential differentiation, or gender mapping. Gender map, writes Money, is the term used to refer to the entity, template, or schema within the mind and brain, mind-brain, unity that codes masculinity and femininity and androgyny. The gender map is a conceptual entity in which are assembled all the male-female differences, and similarities also, not only those that are procreative and phylogenetically determined, but also those that are arbitrary and conventionally determined, such as male-female differences in education, vocation, and recreation. The gender map has a history of growth and development from very simple beginnings to very complex outcomes. It is multivariately and sequentially determined and, therefore, complicated to study. Explanations of its genesis are in terms of temporal sequences, not causal sequences. Underpinning this model are two assumptions that are ripe for critical attention. The first is that there is a normal developmental teleology that, when followed in an orderly manner, will result in an idealized, unified GIR. Consequently, gender-variant corporealities, or gender identity errors, as Money sometimes calls them, are conceived, and thus constituted, as the result of developmental deviations in the course of this naturalized universal system. Second, and related, is the assumption that GIRs and the processes by which GIR differentiation occurs are naturally dimorphic and therefore naturally heterosexual. In gay, straight, and in between, Money writes, gender coding is by definition dualistic. One half of the code is for female, the other for male. A child must assimilate both halves of the code, identifying with one and complementing the other. Postnatally, the child becomes conditioned to adhere to the positive model, which is the one congruous with his rearing and, in the normal course of events, consistent with his anatomy. The opposite or negative valence model becomes a constant reminder of how one should not act. This process of coding, by which two gender schemas develop in the mind-brain, means that gender maps are never exclusively social or biological in origin. Indeed, since learned behavior shapes the mind-brain ontogenetically, by building on what is phylogenetically laid down, it is both wrong-headed and impossible, argues Money, to attempt to differentiate the gender maps in terms of social and biological aspects. It is there, in the brain, writes Money, that ontogeny and phylogeny meet, there that the social customs and traditions are assimilated and fused with one species' heritage. In the brain, socio-psycho, physiosomatic, and/or somato-physio-psychosocial are one. In short, then, gender maps consist of features that are phylogenetically shared with other members of the species and characteristics that are ontogenetically personal, such that gendered subjectivity is at once unique, situated, and in process, and shared, and partially and increasingly determined.